So some of the issues to access for women facing fibroids in many communities talks about discussions about everything below the belt just aren't happening. So not only do they not understand what's normal, but they may not be having a discussion at all about what's alienating them or causing them to have any problems when it comes to menstruation. Their husbands don't want to hear about it, or their moms are telling them, I went through it too, and it's just a rite of passage. So just culturally, a lot of women in a lot of different cultures across the world just do not talk about menstruation. So that will keep and be a barrier to access for a lot of women. And then the care that they receive. A lot of women will go to their doctors and they'll tell their story and again be told it's a rite of passage or it's what women go through, or here, take these birth control pills, but not do an actual evaluation into the pain or the heavy bleeding. An ultrasound is a simple test and many times an actually extremely inexpensive test that your insurance will cover. So getting that done will tell the picture quite obviously if women have fibroids. Fibroids are really easy to detect. Not always easy to detect on exam, but on the ultrasound, they're easy to see. Some of the other disparities is just inability to get to the doctor. So not just on the educational side, but do I have childcare? Do I have access to transportation and reliable way to actually just make my doctor's appointment and be seen? And then lastly, some of the other barriers is in resources. Once I get the diagnosis, can I afford surgery? Can I afford time off of work? Or do I even have access to reliable doctors that are competent enough to perform the procedure that's going to be best for me? That means sometimes crossing the state line for a lot of women. And of course, that takes resources in order to be able to do so. So those are just some of the accesses that we know. Statistically speaking, fibroids affect about 70% of women, but in African American women specifically, that is about 2 to 3 times higher. So we see anywhere from 80 to 90% of Black women suffering from fibroids. Not all of them are symptomatic. Not all of them are even aware that they have fibroids, but it affects a great proportion of women in this country and many countries across the world. We have gaps in the research, just simply because the inclusiveness of all races, ethnicities, and cultures, and even religious backgrounds, because we've talked about how the impact of culturally our differences and what it might look like in our fibroid journeys is important. All of the above are not included in all of the studies. So we do have research gaps. Simply because the right individuals are not making it into the studies for us to have an understanding of how it affects them uniquely. Other research gaps are simply how we're able to assess the fibroids. Do we really understand the pathophysiology of it that makes it different in one individual group of people versus another? Do we really understand the impact of environmental things like the things that we eat, our lifestyles, our stress levels, vitamin D levels, some of the things that we know are connected? How can we use that understanding to expand the research to actually help us address fibroids earlier, right? Sooner than later.